for this procedure, we're gonna start off by just grabbing the pans instead of, because
This you guys know.
You already
It's
know.
just like the,
okay? And then this procedure, we are going to have laps.
so you're gonna pop your laps in your
You're gonna wrap it
basin.
back just like this.
So it would be your suture, laps, and gloves.
Small items.
Small
No.
items in your
And
basin.
towels.
And 4
And
towels.
Yep, everything's all the same except we're adding laps.
And the patient drapes are all the same way.
Yep, everything else is the same.
Literally
Okay.
everything is same.
And
any
these
size
are
wrap.
just ones that we already popped. So if they'll be wrapped like this.
It'll look
2
like
packs.
this.
And a pack of Resection.
Yep. And no integrator in laps.
Yep, no integrators.
Okay.
All right, so usually when we started our first, when we're doing our hernia procedure, we opened our pan from here and we just had that one pan. Now we have 3 pans, okay? So the way we're gonna open these is the same way we did before. We're gonna open this way. So it'll be, you'll open up your major set, open up your bowel set, and then you'll open up your retractor set. When we go to take it back, we're gonna go major retractor first, because we have the patient maybe coming in, and this is in the middle of the room, so we're gonna get this out of the room and away from the bed at ASAP. Okay, so we're gonna take this one first, then our major, then our specialty. Okay, so we'll come over, same thing, check the integrator. Integrator's good. No moisture vibrating.
Good.
Okay, we're gonna put this right there. See an integrator, get in the pan, all that, check the wrap, looks good.
Whoa, whoa.
You're good.
Integrator's good. String is all open, check the pan. All right, if you guys want to come over this way.
You guys can feel free to go up.
All right, so when we take this out, we're gonna have major set first, shortest to longest. Specialty set, shortest to longest, okay?
Are those the Bonnies that you put over there?
No, Bonnie's over here. Those are Russians.
Okay.
Are we getting the Penrose as well?
No, we don't need a Penrose for this one.
No pen.
The Penrose is specifically for the hernia procedure.
For the traumatic horror.
Yep.
Yeah.
You still have Lido and still have saline.
Yep.
Yeah. Everything's the
Everything
exact
else is the same.
Besides the instrument, the procedure, and you have the count.
Oh, you say those are Russian?
Yep.
Yeah.
Okay.
Russian tissue forceps.
We haven't gotten there yet.
So what?
Well, we haven't gotten there yet.
You guys haven't done major yet?
No.
No.
We didn't have Russian though.
Yeah,
Oh, not Russian?
No.
we didn't have. Yeah,
Really?
Oh,
there's a few of them in the instruments for what we did for the instrument.
yeah,
Oh,
we
the
didn't.
hernia, we didn't have
Okay.
the ones.
We didn't have
So,
Coker.
we didn't have
Major
Coker
in
at all.
general the same
So we
thing.
didn't know.
Coker,
Yeah,
like
we
the
didn't. We did not have
Yeah, we
Coker
didn't
either.
have
Okay.
Is major in
So
general the
Russian
same thing?
clamp, you guys, is for normally for
There you
lymph
go. We'll
nodes.
pass it around.
Okay.
So Russian, it has a little weird little teeth to it. It can be a little sharp. Most likely it's like a dull / sharp. It can rip tissue. Normally it's a better grip to grab a lymph node. So you guys want to pass that around, look at the teeth. It comes in this size, 12 inch, 13 inch, whatever inch. Okay, all right. You
You
guys
guys,
can pass
I'm
this
gonna go
back
ahead
around.
and, I'm going to put this Balfour together, but after we get done, I'll show you guys how to put it together and everything.
Okay, so putting that together is part of our time?
Correct.
At Balfour?
Yep.
Okay.
Mhm.
How long do we have?
I believe it's 15.
15 minutes, yeah.
Yeah.
Alrighty.
Okay. Everyone's good with the Russian? You got it back? Okay, cool. Alright, so same thing, we're gonna do soft count and then instrument count, okay? Soft counts, go ahead last.
Breaking bands. One, 2, 3, 4, 5. Breaking bands.
You guys will get the better bands, like those packs are better. This is a brand new pack, that's
One,
something like that.
2, 3, 4, 10.
Okay, retext.
Breaking band. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Blades,
1, 2,
needles,
0,
eyeball,
1, 2,
bovie,
1 bovie, 1 scratch.
and other pack. Bands.
1, 2, 3, 0 bands.
Alright, so for the initial count, on the test, you guys will be calling out the instruments. And then
So
the
for the
final
initial
count,
count.
initial count is this, okay?
Inter-op count would be your circulator.
Yep. Okay, go ahead, you go.
Alright, towel clamps. 1, 2, 3, 4. Scissors. 1, 2, 3, 4, 5. Needle drivers. 1, 2, 3, 4, 5, 6. Criles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Peons. 1, 2, 3, 4, 5, 6. Alice. 1, 2, 3, 4. Babcocks. 1, 2, 3, 4. Right angles. 1, 2, 3, 4. Tonsils. 1, 2. Cokers. 1, 2, 3, 4. Sponge sticks. 1, 2. Knife handles. 1 in hand. 2, 3. Suction. 1 pull with sheath. 1 tonsil. Pickups. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Okay, so you said we will have saline, so that'll be part of the test, is dumping saline again?
Yeah, all of that.
Okay,
Which
okay.
setup,
So
all
you
this
just-
would be the
so you
same,
just-
yeah.
okay.
Everything is all the same, we're just starting with this part because
That's
you guys
it.
don't know the instrument pans.
All right, we
Yeah.
good with major? We good?
Yeah, go ahead.
All right, specialty. Towel clamps. 1, 2. Criles. 1, 2, 3, 4. Alice. 1, 2. Scutters. 1, 2, 3, 4. Coker Allen's. 1, 2. Needle drivers. 1, 2. Scissors. 1, 2. Russian. 1. Retractors. Army Navy's. 1, 2. Goulet's. 1, 2. Richards. 1, 2, 3. Devers. 1, 2, 3. Harrington's. 1, 2, 3. Wheaties. 1, 2. Gelpies. 1, 2. Ribbons. 1, 2, 3. And Balfour. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Okay, so that is the counting part. And then as far as like everything else is literally all the same thing.
Yep.
Same way with draping, same way with towel, everything is all the same.
About the lap count.
Okay.
You said 1, 2, 3, 4, 5, 1, 2, 3, 4, 10.
Yeah.
Okay.
So lap counts in fives.
Yep.
Okay. So sometimes some
It's like
people
5,
Yeah.
10.
1, 2, 3,
50,
4,
okay.
5. 1, 2, 3, 4, 5 for 10.
Yeah.
1, 2, 3, 4, 5 for
Okay.
15. So
Got
And
it.
it depends on the circulator too.
Yeah.
Sometimes they want you to count out 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
1,
Or
2, 3,
10.
4, 5.
Okay.
Yeah.
And laps always count in fives, okay? No
Okay.
matter where you go, that's the standard policy. When you guys go out there, they'll count in all numbers, but just don't do it, okay? Just keep in fives, always
Yep,
fives.
fives.
A pack of, it comes in a pack of 5, then we're gonna count in a pack of 5s.
Okay.
Ratex, 10s.
Same deal.
Same deal.
Count in 10s. 20s.
Literally everything up on this point, the only difference is the instruments. Because you
Everything
guys
else is
know
the
everything
same.
else is the same,
Cool.
okay? All right, so let's do the procedure.
Okay, so you guys, I didn't take my stringer off
He's
because
gonna put whatever you
sometimes,
need up.
sometimes if we're in a hurry, we'll just count our instruments on the stringer and then take them off.
Yeah.
Okay.
If we're
If
in a
you
hurry.
choose to take it off and count, that's
Yeah, that's fine.
too.
It's not wrong.
We're just trying to speed up the process. For
And
some people, it's better that way to take it off.
Mm.
Yeah, I count it this way too. I don't like to take everything apart.
Will you take pictures with when Julie's done with everything?
Yes.
Yes,
Okay.
yep. He's gonna put up the stuff that you need on the Mayo stand. You guys can take a picture. So this setup is for OR2. So you guys share your notes between OR1.
Yeah.
So.
Curved males, straight males.
So I have an anatomy question for you guys. What is the structure that's holding all the bowels together?
Peritoneum.
Frick. Abdominal sheath? Is this some
It
kind
holds
of?
all the, it's like a little see-through layer that holds all the bowels in the
The-
middle. When you lift it up, it looks like a little.
It's yellow though, right?
It's yellow.
Oh, it's like, oh, mentum?
There you go.
Oh,
Yeah.
mesentery?
So
Damn.
mesentery, right? That's your mesentery that holds everything together, all your inside organs sort of together. What about omentum? What's that?
It's like the thing that hangs.
Covers
Curtain.
and kind of
Yeah.
protects, right? Okay.
Yeah.
Know the difference between those two.
Momentum and mesentery.
Those could be key words that when we say we're going in and, oh, I see omentum. Oh, I see this. Okay? So know those key words.
Two to babies. Is that a fourth one?
Alright.
Alice clamps.
So I have a question. Will you use both of those suctions?
Straight.
Yes.
So will you have two suction
Nope.
tubes, or you just have one, you just switch
You
them
just
back?
switch
them.
Okay.
Okay.
And that, as we progress with the procedure, you would know. Okay.
Kind
Got a
of.
good picture of that?
Yeah, but like, okay, are these like Leahy's and Alice clamps?
No,
or?
they're Alice's and Cokers.
Yeah. There's no Leahy.
There's
Cokers.
Kyle's, Alice's, and Cokers from your major, and then Alice's, Coker Allen's, and Scutters from your,
We haven't even had a
special
skirt.
Alice,
It's the
Yeah.
same thing as a doyen.
Yeah.
Oh, okay.
Okay.
Yeah, a lot of these things are the same, they're just different names.
Yeah.
Coker,
And
Allen,
Scutters.
A
Stutters.
doyen and
The
a
curved
Scutter
one.
is the same thing.
Yeah.
Okay.
And you need two curved, two straight.
But these
So
are
grab all your Scutters.
4
Yeah.
Scutters,
Four Scutters.
2 something Cokers,
Those are Coker Allens.
Coker and Allen.
Coker
Kind of like
Allens,
how the Kelly and the Cryo.
Alice's,
For-
and then these are
yeah,
peons?
same thing, just different. Those are
Or those
less
Cokers?
traumatic than the doyen,
Cokers.
but same
So
thing.
2 straight Cokers, 2 Alice's, and 4 curved cows.
No, I just used it because I couldn't get my scissors out
Yeah.
because my stringer was
Oh,
still.
yeah.
Curved mitts,
Okay,
curved
so you
mayo,
can
straight
get
mayos,
Well, you guys go ahead and take your stringer off.
2 to
Yeah.
babies.
Yeah,
We're
'cause
gonna
if you
speed
guys,
things
it's
up.
just gonna screw you guys up if you don't.
Yeah.
size
Don't
is the
do that.
long?
Yeah.
Is that a set?
You don't want us to get
Because-
into
What's that?
Yeah,
What's the
no,
long
huh?
knife handle
Bad
number?
habits.
No, that's how I do it
Oh,
at work.
yeah,
It
that
don't
was-
matter what you count with,
Is it a 5, 3?
but we need you guys to have your
a three.
sutures.
Yeah, that's a
in
three.
No, it's not a
ready
three,
to
that's a
cut
3.
suture. You know what I'm saying?
No, they
That is
are.
not
It's just
three.
bigger size.
It's a 3, but it's extra long.
Okay, so it's a
Okay,
Is
yes.
that Dole's here?
We'll
These
make it,
scissors
you
are
guys make it, put in your group chat. Okay, you're recording anyways. Take the stringer off when you count.
Yeah,
We're
go
just
ahead
trying
and
to
take the
speed things
stringer
up
off,
so
yeah.
that.
Okay.
Okay.
Okay, alright, let's wait.
Okay.
Okay, we got 'em.
Procedure time.
Okay, the supplies that you guys will need is GIA stapler with 2 lows, probably a skin stapler on standby, and a TA stapler. I believe you guys already gone through this in general surgery.
We just covered it today.
Okay, perfect. You guys want to take a picture of this? These are the hold items. So same calipers.
I'm gonna take a close
Everything's the same,
up.
yeah. This is the standard X-Lab.
Here, let me
A lot of
let me open 'em up.
Yeah.
Always 4 to
Oh.
square off.
These are off.
These are the,
So it's all these right
yep,
here.
these are the staples that we load into it.
Thank you.
Okay.
Alright, you guys, come check this out.
Can I go over there?
We're gonna do this as a whole class. So when you guys are unfolding, keep in mind this part is not sterile, right? So when you take a half step or a step, when you take it back, make sure it's still up in this area, in this square. Okay? When you flip it, T does it this way, and I do it another way. There's nothing wrong with
So
either
watch,
way.
Sherry will do it her way, and then we'll switch, and I'll do it
I
her
do
way
this.
up top.
Okay?
Sherry
Same.
catches it right here.
Yep, I like to do this and I do that.
It
It's
still
the
touches
same.
your hand. Okay.
Okay, so everyone, this is the whole class, was doing this weird thing, trying to get that side going. But just, okay, note to self, there's nothing wrong with, as long as you cuff it. All right, this procedure, scrub tech will be the one putting the cords up. Okay, we're gonna wait for you. The only thing the surgeon will take is the light handle. It's up to you guys to do the cord management. Okay, and watch how T does it. After he uses the towel clamp, somebody take a picture of how it's placed. He normally extends it to a point where it's just enough length for us to operate in this field, okay? I don't need all the extra loopy like this. We don't need that, okay? It's just gonna create chaos because later
Your
on
side
I
or my
might
side?
add for, your side's fine. I might add in like ligature device, other, heating, cutting devices. Just wanna make sure this is nice and clear. Okay, we still line the incision. We line with 2 laps.
Is
Okay,
it a midline?
we're doing
Yeah,
a midline.
midline.
That's why we're doing this way.
Okay, okay.
So not a hernia, not a phalansteal. We're doing a midline.
Sharp though.
Okay. Okay. Great. We did timeout. Blah blah blah. Okay, let's get started. Incision, knockdown. Buzz, buzz, buzz. Everything is the same. We're going through the same layers. Buzz, buzz, buzz. Okay. Oh. Okay, I'll take this back. I'll take
Balfour?
2. Balfour, yep. 2 wet labs, please. Okay. This is to protect the abdominal wall or other organs or adhesions or whatever you find in there.
So they need to be wet.
Exactly.
So to keep
Yep.
it
So
moving.
moist. Exactly. Because we're touching like connective tissue, right? Okay. So notice how the way that he handed this to me. Okay. So we take it down, set it down, then you'll help the surgeon, and this is how we pull it apart. This blade should cover on the laps.
Okay.
Okay.
And
Yep.
also, if these laps aren't protecting the patient's skin, if we touch this with the bovie, it will burn the patient.
Yeah. So if I accidentally was boving and bleh, then
And we
Patient's
didn't have
gonna
these
burn
laps, we're gonna
all
burn
the
the
way.
patient.
because this is metal.
Mm-hmm.
Okay.
Okay, and when you hand the Balfour, you wanna make sure that the wing nut is down by the pelvis, because that's where the bladder is, and I'll ask for a bladder.
Okay,
Would you
I'll
like
take the
bladder
biggest
blade?
one. Okay. Then this goes in the middle. Then you push down as retracting, maybe. Okay, like that, and then you can
Okay,
lock
so,
it up.
yep.
It protects bowel, lower pelvic, organs. Could be bowel sometimes too. Okay, you guys, somebody want to take a picture of this setup right here? Alrighty. Okay. All right. We will keep going. Oh, we don't have. Oh, where's the bowel? Oh, this is
yes,
bowel.
that's it.
Okay, that's fine.
Not
So
bad.
yeah. So notice, like sometimes surgeons can change size. I can be a lefty today. Okay. Those are the things I'm gonna throw in there the second test or the final exam.
That you're a lefty and then
Yeah,
we have to
I'm
pass.
not ready. Yep.
Okay, cool.
Sometimes I can't see on this end. If I'm dissecting this way, I have to use left hand.
Mm-hmm.
Okay. All right. So now we're gonna run the bowel. Same thing, like I need something wet, so wet or dry. Okay. So we're running the bowel. Okay. A lot of times we'll pull the entire bowel. We run the whole bowel. Okay. Sometimes it's just the hand running too, or we can use a backcock to run the bowel too. Okay. Or sponge stick. The sponge stick, we can use it for a blunt
Oh, good.
dissection.
I need to get the tie out
Okay.
after this.
Okay. All right, I'm running the bowel. I think I found the specimen or the pathology. Here's that.
I'm gonna
Okay.
go get,
So now, just imagine, guys, we're lifting this up, all the bowel up. What do we see? What's
More-
connected?
More bowel tissue, the omentum.
Yep. Oh no, yeah, omentum. Oh no, that's sorry, no,
Mesentery.
mesentery. Sorry,
Mesentery.
mesentery. So we're lifting this up, so you can
Mesentery's
see the little
connecting it.
see-through, clear kind of tissue here. Okay, that's where it supplies vasculature to the bowel.
okay,
Okay.
all those little
Veins, arteries, all
and
that.
stuff that's giving
Blood.
blood supply to the bowel, and we have to close off all those blood supply to the section of bowel that we're taking out.
Yeah, otherwise it's gonna go like crazy, bleed like crazy.
Okay, so
Okay.
these are your ties. You guys would pop these when you pop your suture, okay? Now, 2 ways you guys can do this. Either way is fine with me. One, you can tear your pack and you have them like this, and you can stick them in your Mayo stand like that. I don't like doing that because it crinkles the thing and then they're
Same.
hard to get out
I am
and
the
all
same
that.
way.
So what I'll do is take a towel, put it on this end of my Mayo, open it up. Just the one right there. Oh, shit, let me do it this way. Take these out. And put them
Just
in
like
my
that.
towel right there. That way I can just pull
It's
them
easy
straight out.
access, it doesn't get stuck.
Okay?
Gotcha.
Okay? You can do it both ways, whichever you like.
Okay,
Okay.
now, whenever we're ligating a vessel, rule of thumb is clamp, clamp, cut, tie. We have to clamp both sides, cut it, then tie it, okay? When we're doing vessels,
take another clamp.
when we're doing vessels, we only use curved mets for vessels, okay?
They're delicate, right?
Oops, my bad.
Okay, alright, hope you hold that. So then you would tie, right? So, okay. Flash?
Well, it will come on.
So if that happens, then that means the blood is shooting everywhere.
So
Okay.
you gotta do it real
Does
quick.
that make sense? So you will do, okay,
Got that much to get on.
yeah. Okay, alright, flash. Okay, flash just meaning that, you know, we have occluded
You're gonna
it.
open it up and see if it's still bleeding.
Okay,
Open what up?
the
clamp.
vessels,
Oh, okay.
Yeah.
Oh,
Oh, we're
okay.
gonna open up the cryo.
the cryo.
Oh, okay.
Okay. Alrighty, we are done with the mesentery.
Then you're gonna pass the mayos to surgeon.
The Mayo, yeah, the Mayo's
To
to
cut sutures.
to cut
You just cut
sutures.
your own
Sometimes we
suture.
cut, sometimes they
Yeah.
cut. It
Okay, all
depends.
right.
Yeah, that's more of an anticipation. Okay, alright, so now we cut off the blood supply. Now we're gonna do scutters. So I can ask for 1 straight, 1 curve, or 2 curve, 2 straight. And then this is the Coker Allen. Okay,
How would you like to resect?
I'll take a GIA
Can I do
with
GI
2
stapler
lows,
with 2
please.
So, yeah, you're gonna do that one, so you're gonna open that box up. Okay, you're gonna bring the stapler over to me, open it up.
Just like a tail pack item. There you go.
Okay. You just come here, just don't go over my table, I'll come to you. Okay, and then I need those other 2 loads. So once I get this, to open this, push this button right here, it'll pop that open, then you can just pull it
You can
apart.
just pop it into the bit.
So yeah, just toss it into my pan or on the table, either one.
There you go.
It'll come open like this. Now, this is the staple part right here. Don't take this yellow piece off. This is a safety. There's a blade underneath here that cuts. So if this is not on here, it exposes the blade. So leave these on here, okay? You can change these out, and I'm gonna show you guys how in a minute, without taking this yellow strip off, okay? So, we'll take the yellow strip off, not for real, that's the safety. Put it back like this, and then we're gonna hand it to the doctor like that.
Okay, I'm gonna clamp the bowel. Okay, it's done.
Okay, this is a dirty, clean case, or a dirty case, depending, but, I'm gonna keep a dirty towel for all the stuff that's been in the bowel or in contact with the inside of the bowel on here. And then I usually put a towel here too, so I can put all my dirty instruments, because we don't wanna mix those, okay? Our dirty instruments and our clean instruments. Take this out. You're gonna grab this, and you use a towel or something, because this could be poopy or whatever, and you don't wanna get it all on your gloves. You're just gonna lift from the back, and it'll pull itself out, okay? Set it down, grab our reload.
Oh, the yellow one, I think, so in there.
Oh, yes.
For the safety, be careful, because there's actually a real blade in there, guys.
Yeah.
Here.
So when you go to put this on, you just go right from the tip and push down from the back,
Say that again.
okay? Take it out, lift up from the back, pull it out. There's these little things right here on the front.
It sits into the little groove right
Yep,
there.
and it'll sit in, all you gotta do is put it like
Tip
that,
down and push in.
and then push from the back,
Tip first and back.
okay? This blade is out. too.
Yeah, we gotta, yeah, just be careful, guys.
All right, actually, I'll use this. Can you put that one back over there, please? Thank you.
So the tape is off.
It's to hold the safety on.
Yeah, it's just to
so
hold
that
the
the
safety.
safety doesn't come off.
So during the procedure, are we gonna leave it?
Yes,
leave it on.
this will stay just like it is.
Just like this.
But
All
in
you
real
guys-
life, you're gonna take it off.
Yes.
Okay.
Yeah.
And when
Yeah,
you go out
just say I
to,
would take
yeah,
out the
in real
safety,
life, yeah.
Okay,
Because
okay.
we just wanna be careful and then we can overuse it, like reuse it too.
Uh-huh.
Okay, so I'm cutting the other side, transecting the other side of the bowel. There's that.
Is this the specimen?
Yeah, oh, not yet, let's, oh
Oh,
yeah,
the
it is,
second one.
sorry, it is. I did, just kidding. Yes.
There, or you're doing that, and then when you guys reload, also, this part, you want to take a Raytech and wipe this off over your dirty towel, because that's going to get all the leftover staples out of this, so we won't get them in the patient, okay? So we're going to wipe those off, and then this can go in the kick bucket.
Okay, specimen,
All right, would you like it called?
small
How would you
bowel,
like it sent?
permanent at the end.
All right, now, when we go to give the stapler back, we're going to get, well, it's not time for that yet.
And I will explain this portion of the bowel resection in the classroom so I can draw a picture. It's kind of hard to explain right now.
To the
with this.
end-to-end thing?
Yeah. Okay. So I'm cutting one edge of the bowel, pretty much two sides, because we're putting two back together. So there's that, the 30.
So these are my dirty scissors. I'm gonna just put them on here because I'll probably might use them again. So I'm just gonna leave them on my dirty thing, okay? Now, we reloaded this. When we give it back, we're gonna give it to the doc in 2 pieces.
Okay, have you hold that, 2 pieces. We're gonna put it together. Okay, that's done.
Dirty, but inside the valve.
Yep. And then, now that we connected the bowel together,
How do you
we
wanna
gotta-
finish,
let's just use, I'll use that curved Mayo again to cut it off.
alright.
Yeah, so this is a dirty, then I will cut the tip off. Yep, and then,
Need a
yep. Oh, we missed this.
TA. Yeah, TA first. So
TA,
I need a
my
TA
bad.
stapler?
Sorry, TA first. Sorry, okay,
That's the other stapler?
rewind,
Yep.
we're gonna get
No,
that.
that's the skin stapler, the other one, that one right
Yep.
there.
We need to do the TA and then we'll cut.
So what we just did was we cut the bowel in half. Now we put it side by side. We cut the
together.
tip off,
Now we gotta finish the, like, the connection on top.
and then the 2 pieces of the GIA go down inside the bowel, and then it cuts on the inside, but we'll show you guys more of that later.
Yeah, okay.
And this, the way they're gonna use it, see how I passed it?
Yep,
The
and
way they're
this
gonna use it.
locks, and we'll go into details once, this is, worry about the setup first. So it's done, here you go. And then now, we will cut the top part off.
Are we saying sharp with the staplers?
No.
Now, the tip will actually come off after we tee it off. Normally, these 4 has a piece of bowel, a strip on top, because we just
Okay,
closed the
it's the part
loop
we
on
cut.
top. And this part, sometimes this could be the final margin, or it could be just trash. Okay, so in this scenario, this is trash, so go ahead and just, this is garbage. There you go. Okay, all right, so now we're done with the bowel resecting. I'll take the irrigation.
Big or small?
Big please.
Alright.
And notice how T's holding this. Okay. And then, as a tech, you'll need to let the surgeon know this is warm saline. Why do we have to use warm saline in the body
Keep the body
cavity?
temperature.
And
Yeah.
what'll happen if we put cold water?
Lower the
Shock,
temperature.
exactly. Perfect. All right, pouring. Okay, done.
Alrighty, how would you like to close?
We'll do the fascia and then skin stapler.
Alright.
And here's all your stuff back.
Needle.
Okay, thank you. Pick up and 2
Fine.
laps. Okay,
Alright,
Great.
give me a second to straighten this up
okay.
real
So
quick.
surgeon sewing. And then, is someone pass me the count sheet, please? Now we're gonna do our cavity closing count. We're gonna do the whole thing. When we're counting this step, the closing count, the circulator will call out the names. Okay.
Okay, notice how I just did it the first time? This time the circulator is going
Alright,
to
you
call
ready?
it out and I'll count it.
Laps.
Alright, laps. 1, 2 on the field. 3, 4, 5. Circulator.
1, 2, 3, 4, 5, 10. Okay. Resex.
1. Oh, I guess he's standing over there with 2.
Yeah.
3, 4, 5, 6, 7, 8, 9.
10. Okay. Blades.
1, 2.
Hypo.
1, 2.
Needles.
0.
Bovie.
1 bovie, 1 scratch.
Scratch. Okay. Pen and cap.
1, 2, 3.
All right. You ready for major?
I'm ready.
Okay. Sponge. Stick.
1, 2.
Coker.
1, 2, 3, 4 in the basin.
Okay. Right angle.
1, 2, 3, 4.
Bab.
1, 2, 3, 4.
Alice.
1, 2 in the basin.
Peon.
3, 4. Peons. 1, 2, 3, 4, 5, 6.
Cryo.
Cryos. 1 up. 2, 3, 4, 5, 6, 7, 8, 9. Yeah, oh. Recount. 1, 2 up. 1, 2, 3 up. 4, 5, 6, 7, 8, 9, 10, 11, 12.
Okay. And Cryo did that. Okay. Needle holder.
Needle holders. 1 up. 2, 3, 4, 5, 6.
Okay. Scissors.
Scissors. 1 up, 2 in hand, 3, 4, 5 in the special. 5 right there.
Okay. Chocolate.
Towel clamps. 1 up, 2, 3, 4.
Left hand up.
1, 2, 3.
Tonsil suction.
1 tonsil.
Cool.
1 pull sheath.
Okay. All the pickups together.
1 on the field. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Okay. Bowel set. Scissors.
Scissors. 1, 2.
Needle driver.
1, 2.
Coker. Allen.
1.
Stutters. Yep.
1, 2 in there.
Yep. Scutter. Or sorry, you did that. Yeah. Scutters.
Cutters. 1, 2, 3, 4.
All right. Alice.
1, 2.
Cryo.
1, 2, 3, 4.
And Talca.
1, 2.
And mushroom.
1,
Okay. And retractor set. Goulet.
1, 2.
Weedy.
1, 2.
Ribbon.
1, 2, 3.
Army Navy.
1, 2.
Rich.
1, 2, 3.
Beaver.
1, 2, 3.
Harrington.
1, 2, 3.
Balfour.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Guppy.
1, 2.
Okay. Counts correct?
Sounds correct.
Okay. All right. So now that we count it, counts correct. Let the doc know counts correct.
Sounds correct.
And then, so there's, I'll just put it right here. And then now, fascial stitch, we're done. We'll give you guys the sutures, but right now just worry about this part first. Fascial stitch, and then Tech can ask, how would you like to close the
How would you
skin?
like to close just
Well,
like the hernia?
Just like hernia. I'll do skin stapler, so go ahead and someone pop a skin stapler. And then,
Just that one right there? Nope, other one?
Yep.
That one.
Just, you can just pop it
And
in.
it'll be
Yep.
the package.
There you go. All right. All
Still
right.
have a count to do?
Yeah, okay. But you're gonna help me staple.
All right.
Staples, guys. It is
So
in-
right here?
Yeah.
This is where you want to line up in between those two accents, okay? There's an arrow sometimes, and then sometimes there's just a little bump right here, okay? You want to put that right in between your accents.
And stapling the skin is under our scope of practice.
So
okay, so on the test, you guys will be stapling. So you approximate the skin together. Go ahead. Good.
Oh, we don't have staples in this one.
Okay. But
I was
yeah.
gonna place the
I
staple.
wanna-
Do we have
I
one in
wanna
there?
show you
Yeah.
guys how to staple too, so.
Let me toss that in the garbage.
So you guys counted 0 needles, but she was working.
Those are needles. What do you call it? She didn't have an actual needle. We only count what we actually have. I don't even pretend. You know what I'm saying? If I don't have it on my table, I'm not gonna count it.
Okay.
She didn't have a needle. She had ties.
Oh, it was a tie.
Okay, go ahead.
Okay.
Yeah,
Okay.
ties.
So right in the middle where the two layers are approximating. Go ahead.
Good,
Yep. One more.
good.
Okay. All right. So it looks like that.
Don't need to get in the field. Thank
Good?
you.
Okay. So, and now same thing.
Wet and dry,
Wet and
gloves
dry. What kind of dressing you want. And then
Then
that's
your
it.
count.
And
And if you
then-
guys, if the doc says they wanna count, they wanna close right now, then we go ahead and close. We can count back here. Even after
Okay.
if we were like in a hurry, like I
Yeah.
wanna get.
Let's
my
say
stuff
I'm
out
done.
here,
You guys are doing your still thing. So the doc will never throw away your countable items. I'm gonna put it back on your Mayo. And then give you the rest, and you guys can do the final count over there.
So we count the instruments 3 times?
No, just once.
Okay.
We're doing a soft count.
From
That's
in the
it.
beginning, and then the closing count, and then the skin count, which is stapler or suture or whatever, that's skin layer.
Okay.
That's the final count.
So that's, okay, so that's.
Yeah, so 3 counts. 1 in the beginning, 1 where you're closing the abdominal wall.
No, we don't use,
yeah.
we'll have Ratex on the field for certain things sometimes, but we will not put a Ratex in the belly.
Yeah.
We will only
Yeah.
use these laps.
It's too
Yeah,
small,
It's too
and
small.
sometimes I ask because sometimes the surgeons do ask, they use that for blend dissection.
Yeah, they will. Yep.
It's very soft, it's more gentle.
But if we know we're not gonna use them, I'll get rid of my Ratex.
Okay.
If we're
So you
not-
won't even add it to your count?
If I have them at first,
Yeah.
or if,
Yeah.
yeah, or if I decide, hey, the doc's not gonna use Ratex, then if they come in my pack, I'm gonna get rid of them before I count.
Okay.
Yeah.
Yeah,
But in
before
this
I count,
procedure,
yeah.
you guys
Yeah.
are do it,
Yeah.
you're gonna do both. Yeah.
So then you would just come back here and do your count the same way.
Yep.
Laps, 1, 2, 3, 4, 5, Ratex, all the way down, and then, counts correct.
Okay, all right, and then it's the same thing, dressing, clean up, blah, 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 asking circulator, do you need help? So, it's actually the same exact setup procedure, except like more
The only
instruments
thing
to
is
it and the
the
count.
instruments.
Yeah, instrument
You know,
counting,
and then your
and then
on
the
hold,
procedure.
stuff, but.
And then I'm gonna tell this group the same as I told the other group, you guys all did an amazing job in anticipation, okay? So on the test, like for this test, I would say, don't focus on the procedure part, cause you guys got that part down, and it changes, right? It just really depends on,
And what he's saying is your steps.
Yeah.
There's too many steps for you to write out these in steps. It's too many, past this, past
Yeah.
that, past that, it's too many. So get a basic idea of how the procedure goes,
Yeah.
okay? And you guys can watch, at home or on YouTube, whatever, see how the procedure goes. And then when you guys question each other, when you guys are doing this, when you guys get a little more comfortable at being surgeon, ask each other, what else could I use besides this? You know what I mean? What else could I use at this point in time besides this?
Yeah.
If I want a self-retaining retractor, I have a Balfour, we have other big retractors that we could use. It won't always necessarily be that one. We may have to ask for it. The doc may get in and be like, hey, I can't use this. I need a book Walter.
Yeah.
So don't get caught up in,
The procedure.
we're gonna use exactly this at this step, because it doesn't always, especially now.
Yeah.
It doesn't work like that. These procedures are too big to pinpoint one instrument.
Yeah.
Cause we got like we said before, the patient's anatomy, the patient's age, have they had surgery before, more adhesions,
And
that type
surgeon's
stuff.
preference, or things
Yeah,
like that, so like, don't focus, like, I was telling the other group, you guys did a great job, anticipation. But however, focus on the setup. I
Yes.
think that's where everyone fell
Yes,
through.
most
It's
of
because
the-
of the setup part.
Yes.
So really focus on that. This part, just know that you'll be using those staplers.
Yeah. And
Pretty
if you
much.
don't know
And
something,
then
it
the
is okay
mesentery.
to ask.
Yeah.
Okay, I'm not sure what's
Yeah.
next. Now, like I said, we're not gonna let you just do that the whole thing.
Yeah,
But if you don't know what's next, ask.
yeah. And I
No,
give
I'm
out
not
cues,
sure.
like listen to the cues. Like what am I saying? Oh, I'm lifting the bowel up. Oh, I'm gonna
So
do
she's gonna
what
check the
next?
mesentery, so we need a cryo
Like,
so she can.
I'm putting two bowels together. You probably
Alice's.
another Alice's, and then come to
Yeah.
So it's
So, like-
listening to the cues.
Yeah, it's just like the
Yeah.
same thing when we
Yeah.
said, oh, I found a spermatic
Oh, I
cord.
see
You
the
guys
cord.
got
What
the
we're gonna
pinrolls
use,
ready.
right?
It's
So,
all
and these
those
are the
keys.
things that you guys gonna hear and see when you guys do. Oh, I see he's jumping.
That's cool.
So any questions, concerns? I would say everyone focus on setting up.
Yes.
That's the biggest thing that got everyone, and it's the time. You have 15 minutes. You gotta get this down. So I was telling the other group, focusing on the steps, yes. Coming with a plan, yes. Start using telling your teammates or classmates to let you know when it's a 5-minute mark, when it's a 10-minute mark. At 5 minutes, all your supplies should be on the table. At 10 minutes, you should be counting. So give you hints to help you set up, to be faster.
So count is, the count is part of the time.
Yes.
Everything,
Yep.
everything.
Yep,
Set
yep.
up from the beginning at the same,
Same glove to glove.
exactly, glove
Okay.
to glove, set up, counting, like studying your instruments, knowing your instruments really well. You don't wanna be looking, trying to tell the difference between two instruments. Like, is this a Coker or is this an Allen? Is this a
Yeah.
back claw or is this a right angle?
So every time you pause,
no-
it's seconds off your
Yeah,
time.
Yep,
know
yep,
your
yep.
instruments.
Okay.
I do wanna say, one of the scissors are really long, and we show this T was sitting in like this. We're okay with that, okay? So it doesn't overhang. One of the tables is bigger, and depending on what pan you get, one of them really hangs out, but one doesn't.
Yes.
So just note to self, as long as you know the content. If you see it's longer, then put it on the side.
Oh, okay, so we can do that once we get out the.
Just
plant
the
to take
scissor,
it off?
though. Just the scissor.
Yeah, just the long.
Just the
scissors,
long
that's-
scissors, nothing else. Just the long scissors.
So it's okay for the basket to hang off in the back a little bit?
No, it shouldn't. That, I was
shouldn't.
about to tell you guys, this
Yeah.
basket, this table, you would have to turn your basket
This
sideways,
way.
but I don't even wanna get you guys into that yet. 'Cause
Yeah, I
It's gonna
don't
screw
either.
you all up.
Yeah.
Okay.
So just do it that way. If it hangs off the back a little bit, it's fine, but right now, just do it like this.
Focus
Yeah.
this.
Are you gonna show us how to put together the Balfour?
Yes.
Okay,
Soon as
yep,
we
we're
get
gonna,
done.
yep, we're done, so you guys,
So there's no fashion needle? No needle for the fashion?
Yeah, well, you guys
We're
have,
gonna
we
give
will
you
have
guys
all of that.
yeah.
They
Well,
just- they
focus
skipped it,
on
they
setup
skipped
and
Okay, okay,
counting
okay, sorry.
First, yeah.
I have a question, so you have
Your hair is sticking out.
the
Oh,
mullet.
me? Oh, shit.
Yeah.
You said you have the 2 layers,
Calm down.
and depending on the anatomy, you're gonna state like the difference, like, oh, I can see the Mayo, what was it called again?
Mesentery.
Mesentery, and what was the other one?
Omentum.
Omentum,
Yeah,
and so.
omentum is what you get in when you
Yeah.
first see, it's
Yeah.
covers.
It just covers
protects all
everything. It's
your
the curtain.
organs.
Okay.
That weird film thing?
Well, that's the,
That's the
mesentery.
mesentery.
The omentum is really thick and fatty,
Mesentery is
like.
the clear
Yeah.
thing that holds all the organs together inside,
Interesting.
right? Yeah.
And when they cut in, it's like right
So if
there.
you lay the
Omentum.
whole anatomy out on the table flat. then that's
Omentum's
what
when
it
you cut right in there, and you see it. And then you gotta
Mesentery.
pull the omentum
Yeah.
back, and then you pull the bowel
For
up,
those
and that's
of
the
you, like,
mesentery.
You know, I don't know if you guys gone to the body exhibition. If you ever go to that, it's really cool. You can
Where's
see all
that again, DC?
Now they don't have it in Vegas.
Because they're too
They
big
had
to
it
fit.
here before a couple times.
We tried
Yeah,
to
just keep them,
before, and it was
Yeah.
just
so you'll
hard
know
to
when
get
you
in
It's
get
there.
really
count.
amazing to see all
They
the
keep them
anatomy.
separate so you
Yeah.
can count.
Maybe I'll go to Vegas.
All right, so Balfour, 11 pieces to this Balfour, okay? This is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, okay? So basically, everything that can come apart on this is counted, okay? The way we put it together, gonna have this, next. That one goes on, next. This one goes on. You wanna have this pointed towards the middle. It should look like 2 hips on the side. If it is this way, it is incorrect, okay? Okay, once we get that on, close that. That way, if it does slide, it won't come off, okay? Once we get that on, now, based on what weight you put for the patient is gonna determine what blades we're gonna start with. If we have a fluffier patient, we're gonna use the longer blades to start with. If we have a smaller person, we're gonna start with the short blades, okay? Now, when we put these on, these will go on both sides. But if we put this on, the blades on, the same way as the wing nut, when we go to put the blades in, the wing nut's upside down, okay? So, in order, if we need to change that, if you happen to do it, just take this off and switch it to the other side, because they're interchangeable. You don't have to take it all the way apart, okay? These knobs right here, it has a little nipple on it. See that? So that'll go in this hole, and then these holes right here is where that nipple's gonna fit in, okay? So when we put these on, we wanna check them to make sure that they're on, okay? Okay, and that's put together as far as we need it. Now, when we count this to make it easy, we'll just count it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
So wing nut is a piece.
Yes, because it can come off.
Got it. Yep.
Okay.
Anything that comes
That's what I
off.
was
Yeah.
gonna ask when you guys were.
Anything that comes
And
off.
also, like, this is this type of Balfour, there's also different types of Balfour out there,
Yes.
so when you guys go out there, it depends on what you see, like,
Yeah,
your
Sherry,
hospital, how many pieces?
ours only have 9. We only
Yeah,
have one
6
bladder
pieces.
blade.
So,
So it just
how
depends
it's
on
assembled.
where you're at.
How often have you used
So
Balfour?
those are 3 different bladder blades.
Yes,
sizes.
small, medium,
I
large,
used it
yeah.
like 2 weeks ago in a esophagectomy, so,
Okay.
yeah. So, it just depends. It's really surgeon's preference. More about like all the old school docs, they like to use Balfour. The newer ones, they
Yeah,
don't
they
really
don't.
use that.
What do the newer ones use?
Like
Alexis,
Bookwalter, Thompson
yeah.
Retractor.
Bookwalter's the one that
They
attaches
hook some to the
Yeah,
field, right?
yeah,
Yeah.
Thompson does too.
Thompson too.
giant one.
When we have some surgeon, well, I have one surgeon I work with, he don't even use
Yeah.
a damn.
And some surgeons, yeah, and one of my surgeons, when they do AAAs, they like to use the Balfour, no like middle chuck, they don't like the bladder part. They just
Like
like
that part.
literally this part to hold the bottom part, and then they put an OmniTrack retractor on top, so it just
Yeah.
depends on what you use, yeah. Yeah. Any questions, concerns?
All the time.
Okay, and it's gonna be a lot, and I really, you guys, focus on setup.
Yeah,
Like,
focus
really
on the setup.
procedure, anticipation, you'll hear the cues, you guys will do just fine.
Nope.
Just know the steps, but this part is the main.
What was the Doyen alternative? What was it called again?
It's a scudder.
The scudder?
Yeah,
Okay.
it's
What
on
does
the
the
count
scudder
sheet.
look like?
I recommend you
the
guys
same.
take a
Yes.
picture of the count sheet
Yeah,
and
they got
study the instruments.
One
same?
straight
Okay.
and one curved.
Yeah.
Oh, okay.
And
And
then
it kind of looks like a Doyen, so all these bow clamps look the same.
achromatic scutters.
Yeah, it's just that, if you know, the Doyen has that one down the middle, this one
Right.
doesn't.
Oh,
It's smoother.
Oh, I see.
Okay.
Also the irrigation, you said small or large?
Okay,
Yeah.
so when you say smaller, big irrigation,
Yeah, what-
this is small irrigation, this whole thing is big irrigation.
Thank you.
Yeah, and the other thing that I forgot to mention too, when we're irrigating, do you guys know what we're checking for?
To make sure there's no poop, like.
Once we're done, once we're
Well, once
irrigating,
we're done with like the anastomosis, what are we checking for? We're checking for 2 things.
Like any
Leaks? Leaks?
Leaks,
Yeah.
anastomotic leak.
yep, air bubbles, yep,
Air
because that means we got a
bubbles,
leak somewhere.
anastomotic leak, or bleeding.
And
Okay, that's the 2
bleeding.
things that we, and that's why normally every case we irrigate
Yeah.
right before we close, because we wanna make sure there's no little tiny bleeders that we need to zap.
Then when we're pouring the saline at the beginning, is it the same thing?
Same
And we
way.
say
Yeah.
this is warm, 0%.
Yes, this
0.9.
is, yep, 0.9% sodium chloride, room temperature or warm, whatever.
Yeah.
Cool, cool.
Do we need to fill the syringe up too?
Yeah, both of those
Everything.
should be filled up.
Okay.
It's just sometimes they might ask for a couple squirts and you just give them this, but then that's why we ask, you want big irrigation or small.
Yeah. Sometimes they don't need to use the whole irrigation.
Yeah, sometimes they don't.
Yeah.
Mm,
Good?
sweet.
Alright, you guys can break into your groups, and then, yeah, get started.
Let me put this back, so.
And this is your final, so you guys have like a full month to do this.
Okay.
Yeah.
When is the actual final? What is it?
It's like second week of March, 16th,
Okay.
something like that. Yeah,
Okay.
I gotta go look at the calendar again.
Yeah, like.
It is the week of
So
the
you
11th.
guys have like literally a month to do this, so.
It's
So
the
you're like,
13th of
don't
March.
panic.
Yeah.
Don't panic, Adrienne.
So
Hey.
break down what you want.
Don't call me by my middle name. I already scanned him. I'll upload him. You don't trust me?
Today, if you guys
Why don't
want.
you
want
trust
my
me? It's
own-
all crooked. Look, you don't even have the orientation
You know
crooked.
what, bring it, give it to me tomorrow. Everyone
Want
gets
my
their,
own document.
We brought them all to the room.
Okay,
They're all in there.
okay.
So everyone should have it.
Okay, so whoever that wants their video,
I guess I should take it
bring your
sideways.
USB drive tomorrow. Okay, so I can download everything and then I gotta rename, rewash everything so I can put it back into your thing, so.
They need to reprint this.
Already.
Yes, all the time.
Help me with this?
Here, put a piece of tape and write tie towel, and then you can fold them, and then you guys could just pop this instead of opening a new pack every time to put them in your towels.
Okay.
So just put a piece of tape that says tie towel, so you'll know that they're tie towels, and just pop these
Okay.
like normal into your.
So that's for practice, and then real time.
Yeah. Yes. We'll actually pop.
Is the circulator popping for you?
What's that?
Does the
No, we
circulator-
would.
We pop
If
it?
you travel.
Yeah, we will
that
pop.
means you're
You mean
traveling
like
with an open item.
our ties? Yeah,
Yeah,
we would
like
pop
the little-
those in our basin when we do our other suture and stuff.
got
We
it.
would pop those too.
Okay.
Yep.
So this is.
So don't travel, no travel.
I just give you.
Did you guys hear
Should I
that?
say? Wait, what do you say? Tie towel?
You will pop your ties in just like you pop your sutures. So it will be those suture ties,
Yeah.
laps,
Small items, and then big
gloves.
items, towels.
Sutures,
Still 4-count paper
sutures,
towels,
ties.
everything's the same.
You'll
laps,
just have to pop more on your table.
4 towels,
Okay.
dock gloves,
Exactly,
Okay.
all the same thing.
tied.
Okay, I didn't go to
The back table needs to be taped. Where, Dom?
I'm gonna put it on.
Wait.
Where the heck did that happen? You never showed us that.
The dark table pack.
You remember Antonio? Yeah. I think it was like, was it right
To
here?
simulate the package.
Right here?
No, it's on the front.
What do you mean?
There's no front or back though.
There's no part, but yeah, it's the side.
Just on the top?
Oh, this part. Alright, so 2 pieces of tape.
They're not in the center. Come on.
Huh?
On the side.
Okay, Mr. Perfect.
You got
Just keep it symmetrical.
You do it since he knows. Follow
You're gonna
Antonio.
put one in the center and then on the side?
Lord.
Oh, the little ones are getting feisty.
You gotta
Not
ask them.
him.
It's all you.
You're older than him, right?
He's older, but he's.
Oh.
That's because she's too young.
No, you were so sassy. Oh my god.
He has like older sisters. That makes sense.
Oh, that's why you know.
There's no work.
Just break it from the middle.
Yeah,
Don't
break tape.
rip the tape off.
No, you can actually rip it. Just get
Break
it
tape. But yeah, but we're not gonna. Oh, we're not gonna
Oh.
rip the tape off. Oh my god.